Hi, my name is Dee, and I'm going to help you navigate through the healthytexaswomen.org site in order to get some information on how to access healthcare services through the Texas Health and Human Services website. You can go to www.healthytexaswomen.org. There is also a Spanish option up top. So you can click on that if you need to provide services in Spanish or access Spanish translation. We'll click back to English. And for this particular site, we'll go straight to the benefits page, and we'll go to the Am I eligible link. So we're going to be looking at the Healthy Texas Women program. And so again, this program offers women's health and family planning at no cost for women that are eligible in the state of Texas. This helps us plan for pregnancy or to postpone pregnancy, and it can also help screen for different types of healthcare concerns. So we'll go through the benefits, and those include pregnancy testing, pelvic exams, sexually transmitted infection services, breast and cervical cancer screenings, clinical breast examination, screening and treatment for cholesterol, diabetes, and high blood pressure, HIV screening, long-active reversible contraceptives, oral contraceptive pills, permanent sterilization, other contraceptive methods such as condoms, diaphragm, vaginal, spermicide, and injections, and screening and treatment for postpartum depression. This program pays for the services listed above. If a health problem such as cancer is found, you will be referred to a doctor or clinic that can treat you. If you're pregnant, you will be referred to a program such as Medicaid for pregnant women. You might have to pay for those extra services. So who can apply? Women between the ages of 18 and 44 years old. Women are considered 18 years of age on the day of her 18th birthday and 44 years of age to the last day of the month of her 45th birthday. Women between the ages of 15 to 17 years old and have a parent or legal guardian apply, renew, or report changes to your case on your behalf. Women are considered 15 years of age on the first day of the month of her 15th birthday and 17 years of age through the day before her 18th birthday. The site and the program also asks that persons are U.S. citizens or legal immigrant status, are a resident of Texas, that people do not have other forms of health insurance and are not currently pregnant, and meet the following income requirements. So we'll go through that. So I'll just show you the different family size, including yourself. So for family of one, the maximum family income is $1,980. A family of two, 2,670. Family of three, 3,360, and so forth. And so how to apply. You can fill out the application online here, and that link should take you to the Your Texas Benefits site in Spanish, and we'll click on there just to make sure that works. And well, it is popping up, but it's popping up in English. And we can go back or go to the actual slide. I guess that's just a printable version. This is the Your Texas Benefit site. And I guess if once you click on the Spanish link, then you can see it in Spanish. We'll go back to the form. Okay, and this is a printable form. So here we'll just, this site will ask you for your identity, your income, and income on child care, if any, or child support that you receive or have to pay, and your citizenship or immigration status. So we'll go back to the form, which is name, date, your date of birth, social security, address, city, zip, county, mailing address, state, zip, county, um, phone number, driver's license, ethnicity, and that is optional. Um, it does ask for race, but it looks like that is also optional. What your citizenship status is and whether or not you have proof. And if anyone in your home receives women, infants, and children benefits or WIC, if you are pregnant, if you have health insurance that covers family planning, and then if yes, if we file a claim on your health insurance, will it cause your physical, emotional, other harm from your spouse, parent, or other person? Yes or no? And if yes, then there is, if filing a claim with your health insurance would cause you harm, would you need to use extra pages? And you can explain here. Tell us about everyone who lives in your home. Do not re-enter facts about the women listed above. Use extra pages if you run out of space. So assuming that you've entered information about yourself up here, you would not need to enter information about yourself in these spaces. Okay, and tell us about the money coming into your home. And so here you can enter any information on about income. So the person who gets income, whether it is yourself or a child, if it's coming from where that money is coming from, how often it's paid, and the amount that it is paid. Tell us about costs everyone in your home pays for. So that would range from daycare for children, adults, alimony, court-ordered child support, or getting your children to and from daycare. You need to give proof of the money you paid for these costs. So assuming there is a receipt of some sort or a letter that maybe you can provide. A letter legal guardian must apply for you. And so this information would be for people 15, 16, or 17 years of age. And you can sign at the bottom. And if there is also an option to register to vote here. And that is this is all for voting status and agency staff signature, so that is not for you to sign. Then you will need to give us, okay, well, we've done all that. Copy all items of proof and fax them to this. Okay, so then you can fax this form to this number, or you can also print out the form and mail it to this address, Healthy Texas Women, P.O. Box 149021, Austin, Texas 78714. You can also direct questions to the 211 number or the 1-877-541-7905. And you can also it looks like you can also submit online. It looks like you can submit online, and you should be receiving a letter soon after you submit this information requesting the information that they've asked for, which is the identification, income, and I believe that correspondence will be through mail. I hope this was helpful as far as obtaining access to the Texas Women's Health Program to be able to speak to a provider and be able to screen for different concerns and address any healthcare services you may be in need of. Thank you.